Well, thank you all for being here. Obviously, we've got a lot of the players behind me. There were a lot more, but see, these are some of the leaders in conjunction with the crafting and obviously the passage and implementation of the trauma system. You all know that Arkansas was one of 3 states that didn't have a trauma system, and the only state that didn't have a level 1 trauma center. And obviously, this goes a long way toward trying to improve the health and welfare of our people, particularly those who are involved in traumatic injuries. Not only the death figures that you've seen quoted being obviously reduced, but also the serious injury figures that are even greater in terms of the ability to be able to treat injuries in a much quicker fashion, and obviously with the appropriate expertise to at least lessen the likelihood of a significant long-term disability. Better health care, better traumatic injury treatment, saving lives, reducing permanent disability or permanent injury. All of these things are really not quantifiable in terms of the value. Statistics are just statistics until you actually see an individual whose life could have been saved or whose future could have been improved had the appropriate trauma system been available. There's a picture over here that we talked about before that actually puts a face. So it brings it home. It keeps you from just talking about statistics and makes it real. And that's what this is all about, trying to help people and save people and save families. A lot of work was done behind the scenes. I specifically want to call out Joe for his leadership as our Surgeon General. He provides enormous policy leadership in the entire healthcare and injury prevention, disease prevention arena. But he doesn't do it alone. He'd be the first one to tell you that all these other folks that are back here as well, both in the medical community as well as in the first responder community, whether they're EMTs or whether they're fire departments or law enforcement, all play a vital role in trying to make a system better. So we're here today to sign a bill and say thank you to so many people. Leadership in the House and the Senate obviously continues to be exceptional. Members of the House and the Senate who are represented here provided that leadership and actually implemented the public policy necessary to be able to stand up here before you today and celebrate this event. So you can't say enough about the legislature. The House and the Senate have worked tirelessly and have provided enormous input into this day being achieved. A lot of people thought it would never be seen. You know, I know Dr. Shelby thought it never would happen, didn't you, Doc? So let's get on with signing the bill. You gonna hand them out?
I believe so.
Thank you.